One of the conditions that I treat very frequently is a hiatal hernia. Now, many people have heard of a hiatal hernia, but there are hiatal hernias and there are hiatal hernias. It's very common that someone is diagnosed with a hiatal hernia on a routine endoscopy, but that hiatal hernia can be small. There are patients that come to me that think they have a hiatal hernia when in fact they have an abdominal wall hernia. So it's a poorly understood hernia because it's not something you can see. Instead, it's a hole in the diaphragm that's gotten incredibly large. And in these patients with what I would call a paraesophageal hernia, which is just a big hiatal hernia, most of their stomach is up in their chest. Typically, when we think of hiatal hernias, we think of acid reflux. And there truly is an association between the presence of a hiatal hernia and gastroesophageal reflux disease. Those patients with paraesophageal hernias, however, rarely have gastroesophageal reflux. They may have had it 20 years ago, but currently what they experience is incredible discomfort after eating. Most of the time they'll express it as a pressure in their chest. Oftentimes it will require time or even vomiting to alleviate that pressure. When I see these patients, they've often had these symptoms for years, and they've changed their lifestyle dramatically to accommodate their new existence. Oftentimes they won't go out for dinner, they'll eat very small meals, and that significantly affects their quality of life. In addition, many of these patients have severe episodes where they're in pain for hours at a time, sometimes even landing in the emergency department. In my mind, someone with a large hiatal hernia should have it fixed laparoscopically or robotically, which allows them to go home the same day or the next day and alleviates their symptoms immediately. I find it very rewarding to see a patient after surgery whose symptoms that they've been having for decades are gone overnight.